Hi everyone, so today I want to talk to you about the different types of brow lifts, and remember these are not all of them but the most common ones we always use. So the first category is the type of brow lift that actually doesn't require any surgery, and by that I mean the neurotoxin family. So you could use Botox, Dysport, Juvu, all of these things, and the way it works is that we inject a little bit around the corner to prevent the depressors of the eyebrow to be paralyzed, and subsequent to that the brow goes up a little bit. The limitation of that is that it only lasts 3 months, so as long as the Botox is on, we can use that. You're not going to get a huge brow lift with that. The second category is the type that actually requires surgery. So a lot of times when I'm doing an upper eyelid blepharoplasty, we do an incision. Through that same internal incision, I perform what we call a browpexy, where a couple of sutures are placed internally, and that in result lifts up the brow without the need to cut anywhere else on the body. The third one is called a direct browplasty. With this type of browplasty, we make an incision over the eyebrow, and usually it's reserved for older gentlemen who have lots of skin and we have to remove that. So the incision is over here and it's hidden because it's right over the eyebrow. The next type of browplasty is the type that I've showed a video of it a few weeks ago. Basically, we hide it into the crease and lift the eyebrow up directly. Again, that procedure is performed under local anesthesia. Another type is when we hide, it's called a temporal browplasty, where we hide the incision behind the hairline here and lift the corner of the brow to give a lift in that fashion. Opens up the corners of the brow. And the beauty of that is the incision hidden, and we can do that under local anesthesia. The most common type that you might have heard of is called the endoscopic brow lift. The thing with that procedure is that it has to be done under general anesthesia. It's a common procedure I do all the time. Basically 4 incisions are made, 2 here in the corners and 2 over here, all behind the hair, and then we free up the entire forehead, lift it up, usually anchor it. I use endotines, but you can use sutures that are permanent and they last and the incisions are closed. And the last one, which is the one that we don't really do anymore, is called a coronal brow lift, where we make an incision all the way from here to here and lift the entire forehead up. For obvious reasons, because it takes so long to do that procedure, nobody really does that anymore. But these are some of the examples. If you have any questions, please leave a comment and we'll get to you very soon. Thank you.